Hey everybody, this is Cody coming at you from SOS headquarters, and we're live with Bishop Tom Kiiza from Kisebere, Uganda. Bishop Tom has been with us all week, working with us in the warehouse, and we are actually sending a container of supplies and equipment to a clinic that Bishop Tom has spearheaded in his hometown in Uganda. And we wanted to share a little bit, have Bishop Tom share a little bit of his story about why he wanted to do this. So the container that we're sending is going to go to the Mama Sabina Health Clinic, rural health clinic. Yeah. And tell us a little bit about the project.
The project is called Mama Sabina Rural Community Health Center. It has been established by the local community, by the local people, because in that village there is no health center. And the whole purpose of it is to save the lives of mothers and children. There's a high mortality rate. There's a high maternal rate death because mothers cannot access health facility when they want to give birth. Children are dying, mothers die while giving birth, and so this project has been established to mitigate, to reduce these deaths because most of them are preventable. Mm-hmm. And then also to improve the general health of the community because a healthy mind in a healthy body.
Right.
Once people are healthy, then they will be able to produce quality services, they will be able to farm, they will be able to run their businesses, and the community will develop. Mm-hmm. When these children are healthy, then they can learn properly. Yeah, so it is an intervention that is needed and so urgent in this community. And that is why I have come all the way from Uganda to United States of America and mainly to Supplies Overseas to say thank you, but also to see the items as they are actually being loaded in this container that is coming, so that together we know what is needed, together we know what is important for the lives and health of this community. So thank you so much to Supplies Overseas, and we look forward to be fruitful partners, but also call more people to support Supplies Overseas, because not only Uganda, these people are touching lives of millions of people all over the world. And I want to implore more sponsors, more donors, more partners to come on board to help the work, the great work that Supplies Overseas is doing in the world.
And you said it was your mother's dream to have a health center in your town, right?
Right, it was my mother's dream. She passed on 4 years ago, but she had seen this project start. It was a dream because she lost 7 children because of poor health, because of failure to access maternal health services. And I'm among those who survived by luck. I was born in a kitchen at night, no light, nothing. So I could have also died. And so my mother went through this agony, and she didn't want other mothers to go through the same. She didn't want children die because they are coming to the world. She didn't want mothers to die because they are giving life to the world. So it was her vision and dream that a health facility be established in this community. Mm-hmm. And indeed, that is now the dream that has come true. Mm-hmm. And we are grateful for the sponsorship through Supplies Overseas that has enabled us to complete the maternal ward, which is the most important and critical part of this project, where mothers will no longer deliver on dirty floors, where children will have a bed when they have been born or when they are sick, and then they have that clean environment when we treat them.
Yeah. Our president and CEO, Denise Sears, actually visited Bishop Tom in Uganda when she was traveling through Africa last fall, and that was one of the stories she brought back to us, was that one of the reasons we're sending hospital beds to this clinic is so the mothers won't have to have their deliveries on the floor anymore. So just bringing the type of healthcare and medical access that we take for granted here in the United States, bringing that to a village that will improve the lives of the mothers, make safe deliveries possible, and give the children a chance to live a productive life. And you said people would be traveling, because the village is the eastern or western part of Uganda, so people will be traveling from a long ways away to receive health care from this clinic.
We are in a catchment area of over 2,000 to 3,000 people whom we are going to serve once this health center is equipped. And so people will be walking, let us say, a radius of 3 hours, 2 hours, coming to the clinic. We also at the border with the Democratic Republic of Congo. So we also expect people to come from Congo, because the health system and the services in the Congo is even worse. So we expect people to come from Congo, but we also have a high rate of refugee efflux from Congo. So all these will be served at this health center. Yeah.
Well, we are sending out the container to Bishop Tom's clinic in a couple of months, and we will definitely follow up with you and continue to tell you the stories of the resulting impact from the supplies and equipment that we send. So stay tuned for that, and thank you, Bishop Tom, for sharing your story with us, and we will see you next time. Thanks, everybody.
God bless America. God bless Uganda. God bless supplies overseas. Thank you so much.
All right.
It was my pleasure.